So the patient-centered oncology conference typically addresses the current issues that are challenging the delivery of cancer care in across all the settings. In the current situation, the biggest topics that concern us is number one, the access to care, and which is COVID-19 global pandemic. That's first, and that's an immediate term. The other thing that affects all of us is the issue about the PBM. So, there are 30% of all the cancer drugs are now available in the oral space, which is either kind of dispensed by the clinicians or they are dispensed by the PBMs. And there has been so much opacities in how the pharmacy benefit managers come back with the recommendations for the approval, disapproval, the step therapy added, all of that. So which can create a significant discrepancy in access to the care across the country. So that's second issue. And the third issue is where we are heading with the alternate payment model, particularly when you look into we are reaching towards the sunset part of the oncology care model. And we were supposed to have some sort of guidelines onto the application process for the oncology care first, but with the, again, global pandemic and the COVID-19 challenge and public health emergencies, everything has been on hold. So the three big issues that I think are of relevance are, of course, the alternate payment model, the oncology care first. Second one is access to care, particularly as long as the oral treatment for the cancer is concerned, step therapy added. And the third thing is, of course, the global pandemic. And I just want to add the biosimilars now. The biosimilars are available across all these therapeutic lines. So these are the main issues that I think are going to be very relevant in discussion about how we navigate our path to the next phase in this situation. Alexandra, she actually is very heavily involved in both the operations and designing of the newer model. And the biggest question I would have with her is that how far they have come along in the design of the model. And when they initially declared they announced the oncology care first model in November 4th or 5th of last year, they came back with some suggestions that included EPRO, and of course they've taken into consideration lots of feedback points from the stakeholders like us, Community Oncology Alliance, ACCC, AMA President Dr. Barbara McNamee, and all of us. And how many of those concerns have been addressed, and when do they plan to announce the new model, and when they're going to actually sunset the current model? So these are some of the uncertainties that we are still navigating through. So my biggest question to her will be, when will they announce, and when will they announce the details of the model as well? The chronic care management has been one of the most successful program developed on the foundation of the Robert Wood Johnson's supported study about 10 years back, when the entrants in the study, the Medicare beneficiaries with two or more chronic conditions that were going to last beyond 12 months and beyond that, and how it could impact the access to care, how we could reduce the likelihood of patient using the emergency room because they didn't have access to care. So chronic care management, how do we implement, particularly the global pandemic has highlighted the role of telehealth, and chronic care management actually was the precursors of a lot of the operational finitudes of the telehealth. So I think the speakers, I would like to elaborate upon how do you operationalize, how do you enroll patients, how do you create the care plan, how frequently do you call, how do you act if you find that somebody needs access to care. So all of these are operational details as well as enrollment details would be relevant for the audience to hear about the chronic care management.